Birthing problems, known as dystocia, are common veterinary emergencies. Difficult deliveries seem to occur more with dogs than with cats, but both may occur. Most pets will deliver and care for their young with little need of assistance. So when is human intervention or medical intervention necessary? A good rule of thumb to follow is that a dog may go up to 4 to 6 hours of exhibiting light contractions without producing a pup. 20 to 30 minutes of heavy contractions would be the upper limit of how long they should go before seeking intervention. The primary area that may require home intervention is if a puppy or kitten becomes trapped in the birthing canal. These newborns should readily pass through the pelvic canal. If a puppy or kitten gets stuck halfway out, follow these guidelines. First aid for assisting a delivery involves being prepared to assist in pulling out the newborn. With clean hands or latex gloves, grasp as much of the newborn as can be visualized. When the mother is pushing, apply a gentle but steady pull on the newborn. Do not pull when she is not pushing. Pull straight back and slightly downward. If multiple attempts are not productive, seek veterinary attention immediately. Once the puppy or kitten has been born, the mother will usually attend to the newborn. She should instinctively lick at the newborn, attempting to free the amniotic membranes from the puppy or kitten if they are still present. This licking action also serves to stimulate the newborn to begin breathing. If this is not occurring and the newborn is not breathing on its own, home intervention should take place. With a clean washcloth or paper towel, firmly wipe the membranes from the face and mouth of the newborn. These membranes may have to be broken to free them from the newborn. Continued rubbing of the body should help to further remove the membranes and stimulate breathing. If fluid appears to be present in the mouth, wipe it out with the paper towel or washcloth. If the puppy or kitten still does not begin to breathe, rigorously rub the chest area with the towel and examine the mouth to be sure it's clear of fluid. A bulb syringe can be used to suction fluid from the mouth. In most cases, these efforts will sufficiently stimulate the puppy or kitten to start breathing. If the mother does not separate the newborn from the placenta, then the owner may have to assist in tying and cutting the cord. Using clean thread or string, tie a tight square knot approximately 1 inch from the puppy. Cut the cord approximately 1/4 of an inch from the knot, being sure the knot remains with the puppy. This cord will dry up and fall off during the first week. The final veterinary emergency we will focus on is that of seizures. A seizure is not a disease, but rather a symptom of a disease. Seizures are the external manifestation of either epilepsy or some other internal disease condition. A seizure generally appears as an uncontrolled convulsing of the body. This violent, uncontrolled trembling may last for a few seconds or a few minutes. Seizures that last for more than a couple of minutes may be very serious and should receive immediate attention. Seizures of less than a minute in duration are not typically life-threatening. Some pet owners, however, will think their pet is dying. Though not every seizure necessarily requires an emergency trip to the veterinarian, it is certainly a good idea to have the pet thoroughly examined following a seizure. The times when it is more imperative to have the pet examined would be when a seizure or seizures are lasting several minutes or longer, when there are multiple seizures occurring within a number of hours, when toxin ingestion is suspected, or if the animal does not appear normal between seizures. There is not a lot a pet owner can do for their pet while it is undergoing a seizure. First aid for seizures should consist of 3 things. Keep the pet from hurting itself during the seizure. This might include falling down stairs or off an elevated deck. Do not handle the animal near its mouth, as this creates a real possibility of the owner getting bit during the seizure. Next, accurately record the time of the seizure, how long it lasts, and any other unusual details that might be beneficial for the veterinarian assessing the case. For example, sometimes a pet will exhibit a certain behavior minutes prior to the start of a seizure. And finally, contact a veterinarian. They will be able to help assess the individual situation and determine if immediate medical attention is indicated. Pets that experience seizures as a result of epilepsy are sometimes placed on daily medications to help control the frequency and severity of seizures. The 12 emergency situations we have just touched on are certainly not the only emergencies a pet may encounter, but being prepared for these situations will likely save the lives of a pet in need.